Tonight on Let It Rip.
It's really concerning to see where our numbers are over the last couple of weeks in the state of Michigan.
Our state now leads the nation in the rate of new COVID infections, and health experts warn of a fourth wave. So why the surge now when more of us than ever are vaccinated? But first,
it was obvious that he was attacking me, that if he would have got the shotgun from me, then it was this is a life or death situation. And I'm going to have to stop him from doing this, so I shot.
A surprise move in court as one of the men accused of killing Ahmaud Arbury in Georgia takes the stand claiming self-defense. It comes a week after Kyle Rittenhouse made a similar move facing his murder trial in Wisconsin. Time to let it rip. On the panel tonight, some of the best attorneys in the state of Michigan. She's handled some of the most high-profile cases and clients in criminal court. Attorney Lillian Diallo is back. So is Attorney Terry Johnson, a vocal supporter of the right to bear arms, who handles both civil and criminal cases. Plus, as always, anchor attorney Charlie Langton. All right, let's begin with the trial down in Brunswick, Georgia, involving the death of Ahmaud Arbury, the black jogger hunted down by three white men who thought he might be a thief. Arbury ended up dead, and today the man who pulled the trigger took the stand, Travis McMichael, admitting that he fired the fatal shot, but he claimed he had no choice, tearfully testifying that it was a life or death situation. Lillian, how do you see it?
He created the risk. He created the hazard. He is the person that went after Ahmaud Arbury, who had every right as a citizen in the United States to go jog and do whatever he wanted to do without being hunted down by whomever you want to call them, who had affiliations and ties with the police, with the prosecutor's office. They felt a comfort level of going out there and doing what they used to do, hunt Black people down with no impunity.
Terry, Travis McMichael didn't shoot Arbury just once. He shot him 3 times.
Yeah. Listen, I have to agree with Lillian here, to a point. Number one, he put himself in that situation. He being Mr. McMichaels, listen, you can't use lethal force to protect property in any state. I mean, Texas has a little twist to their laws, but it still has got to overcome some other burdens. But you can't, if someone's stealing something, let them go. And I'm not saying, that Mr. Arbury was or wasn't, but the mere fact that, this seems to be a situation over property, and no property is worth taking or losing a life over.
And Charlie, the video we saw at trial seemed to indicate that there was nothing stolen. In fact, they had the owner of the property testify that several people had gone to this house under construction. Nobody stole anything, not even Ahmaud Arbury. So you have to wonder what was going through the minds of these people. Go ahead.
Sorry, Hill, but I don't think this is a hard case. I think the jury is going to come back and convict these 3 people. Now, there may be some subtle differences when the guy took some pictures or something, but bottom line here, nobody saw Arbury do anything wrong. He was jogging. And these people took it upon themselves, some vigilante justice, to go get guns to, if I remember correctly, get into the pickup truck and then search for this guy. And then they get into a fight with this guy. I mean, this is a no-brainer. This is not self-defense. They created the ordinance. They created the situation. They instigated this situation. And I really don't think this is going to be very difficult. And I was not impressed with his testimony at all today. In fact, I question a little bit why they put him on the stand, because he just didn't come across as being very credible. And he came across as being some kind of a vigilante to me. And I think it's going to hurt him. And I think that's a big mistake for the defense.
But they have to put them on, Charlie, for, I get it. Anytime anybody comes with self-defense, for the most part, unless there's some other extenuating circumstances, in order to get that jury instruction, you have to get on the stand and say, I did this, but this is why I did this. And his why just didn't seem to come across too good today.
Yeah. But meanwhile, the racial overtones in this trial are obvious. And what's even worse, the defense attorney has requested that the judge keep Black pastors out of the courtroom. I've never heard anything like that. Maybe 40 years ago, but this is 2021.
Well, in some places it's 2021. Business goes on as usual in certain places, right? So to have a defense attorney, anybody, right, who is supposed to do justice some kind of way, say, we don't want Black people in the courtroom. I don't care if they're pastors. I want to go get ordained so I can sit in there too. How dare you, right? It is an open courtroom. And I'm going to digress a little bit from Mr. Johnson. You don't have to put people up on the stand for self-defense. I've had plenty of them, right? And that's where they made the fatal mistake in George Zimmerman. They didn't have to put him on the stand to get that instruction because he
made statements to the police about self-defense. Mm-hmm. So there are other statements that can come in to support and get an instruction on self-defense. He should never have taken the stand.
Well, again, as I said earlier, and you're right, Ms. Diallo and Charlie, but as I said, again, unless there are some extenuating circumstances like statements or other things that you have made. So in order to get that, yes. But even, let's get back to the pastors though. You know, here's the thing. I understand the motion. I would not have made it, okay? But again, would it be any different if this was somebody from the KKK, a known white supremacist who was coming in supporting someone? Would that motion be made then? Probably not, okay? I mean, it is an open courtroom. And to me, to make that motion, it just shows some sense of desperation, as far as I'm concerned, on behalf of the defense team. It's not something I would have made.
But I'm not so sure that the outcome is guaranteed. There are 3 white men on trial for killing a Black man, and yet there's only 1 Black person on the jury.
It doesn't matter. There are more racial overtones in this case. I'm not totally naive to that fact, but in this case, though, the jury's going to be scrutinizing the self-defense, and they're going to ask themselves, why was Travis McMichael and his father there anyway? What were they trying to do that the cops couldn't do? Nobody saw this guy steal anything, and even if you did, a citizen's arrest with guns for stealing property, it makes no sense. It's preposterous, and I don't think the jury's going to be out there. I don't care how many white, Black people. I don't think it matters at all in this case.
And here's the thing, even if he did steal something, as I said earlier, even if he did, it doesn't matter. You're taking someone's life over property. That's a no-no. No property is worth someone's life. It's not worth it. So yeah, I can't call that self-defense.
But we can't get back to the issue, right? He did not take anything. He had every right. If anybody was supposed to stand their ground, it was Ahmaud Arbury, who should have stood his ground. He was legally correct, right? It's that old racist stuff that says Black people steal. So no, this Black person, and we don't all steal, trust me, right? He didn't steal a thing. He had every single right to be there. So, we need to stop demonizing him. He had the right to be there. The 3 people, including the one that filmed it, I would love to know what went into that whole thing. Was this going to be for giggles later on, where we went and hunted down one of them good boys?
Well, meanwhile, look, let's go to the Kyle Rittenhouse case in Kenosha, Wisconsin. He said he had the right to be there too. The jury is now entered its 2nd day of deliberations, no verdict. But I saw something I've never seen before. Defendant allowed to choose out of a rotating drum which jurors would go home and which would be allowed to decide his fate. But Kyle Rittenhouse says he too had a right to defend himself. What do you think? He started it. It's so awful, right? He's 17, right? So when you go there, he's young, his brain isn't developed, with an AR-15 or whatever, a very powerful weapon, okay? You go there to do what? You're not the police, right? It's the same almost vigilante thing. I don't know, it looks like everybody was coming together. However, he goes down there with this big old huge gun. You stay in something, you get in something, and then all of a sudden, hey, I didn't do anything. And remember, they did not allow in the part of the video where he said he was going to shoot looters, right? So it is what it is.
Well,
in fact, the judge ruled that people killed, Kyle Rittenhouse admits he killed 2 people, wounded another, but he said that those people could not be labeled victims, but could be called rioters and looters during the trial. Terry.
Well, here's the thing. We just got to look at this. Whether first of all, he had a right to be there. Just like you said, Lillian, earlier, he had a right to be there. My question is this: if I'm running down the street with a gun, whether it's a AR, whether it's an AK, whether it's a handgun, and somebody comes up to me and hits me with the skateboard, I know their intention at that point. You had the other gentleman who pulled a gun out on him and tried to shoot him. This man was defending himself. No question about it. Now, should he have been there? Probably not. Does he have a legal right to be there? Yes. What was he doing wrong there? He was doing nothing wrong. And this case, to me, does not strike up racism, because I hear people say that Mr. Rittenhouse is a racist, he's a white supremacist. And if he's a white supremacist, he is the worst white supremacist ever to be shooting 3 white people. I mean, come on. That makes no sense to me.
To me, this case is far more problematic than Arbery. But I think you have to look at the 2 people, the 2 shooting incidences. The first one involved the guy, Mr. Rosenbaum, who, as I understand the facts, he threw a plastic bag at Rittenhouse. There's no way is that ever going to rise to the level of self-defense. He
pulled a gun on him.
He threw a bag. That's what he did. He did.
He pulled a gun on him, Charlie. Go back and look at it. There were 2 guns pulled. The third gentleman who had his arm shot had a gun, and Rosenbaum had a gun as well.
No. I'll get to the other one. Now, the other one's different now. Now, in the other one, okay, so after this incident, and people may have seen him kill this shoot, okay, I got it. But here's the deal. Now Rittenhouse starts running away. He falls to the ground. And then people come up to him, they hit him on the head, they hit him with a skateboard, and they kick him. And then while he's on the ground, and then it looks like from that video that one of them is grabbing the gun. Now at this point, I would say that maybe self-defense would be legit for a jury to consider. Rittenhouse is running away and he is being attacked, not 1, but by 3 people. So I think at that point, self-defense is proper. And I think the jury may see it that way and relieve him of that shooting, but not the other one.
All right, panel, look, it's all the time we have right now for this segment. We thank you for your comments. We'll check back with you later as these trials resolve themselves. All right, coming up, we've got a panel of doctors here to discuss the surging COVID case rate in Michigan. Even people who've been vaccinated are now getting sick and dying. Why is this happening? And what can we do to stop it? That's coming up. Welcome back to RIP. On the panel right now, Dr. Mike Basuito, a surgeon and member of the Wayne State Board of Governors. Also with us, the CEO of Carefree Medical, Dr. Farhan Bhatti, who has dedicated himself to helping the poor and underserved in our state. You've already met Charlie, but I want to begin tonight with the doctor who once ran for governor of Michigan, public health care expert and author of the book, Healing Politics. Dr. Abdul El Said is back with us. Well, doctor, the state of Michigan has the highest COVID case rate in the country right now, more than 500 per 100,000. It feels as if we made no progress at all, but you say that the numbers don't tell the whole story. What do you mean?
Right. Well, it's helpful to go across the pond to Europe, and they've been about a month ahead of us throughout this pandemic. And what you're seeing there is rising case counts. In fact, they're setting records in the number of cases. But what's happening is you're not seeing mortality, the number of people die of COVID-19, follow along. In fact, you're seeing like 25% the number of deaths as you would have expected this time last year with the same number of cases. And why? That's because vaccines, they work. They have upwards of 70% people vaccinated. And so it has taken COVID from being a disease that has a high mortality to being one that has a far lower mortality, largely because the cases that you're seeing are either serious cases among people who are unvaccinated, or far less serious, far less symptomatic cases among people who are vaccinated. And so it tells us that we should be thinking a little bit differently about what this surge means, and that we thankfully have vaccines to protect us. And finally, if you're not vaccinated, please do your part, get vaccinated. It's the most important thing you possibly can do to protect yourself from the rising case count and to have a great Thanksgiving and a great holiday with your family.
Dr. Basuito, you got the vaccination. I got the vaccination. I got the booster too. We were told that this would bring us closer to the life we once had before. What do you think is happening?
Well, I agree. These vaccines, they are phenomenal. They work. And that's why I am double vaccinated. I have a booster. And thank you, President Trump, for bringing this with Operation Warp Speed. But they're not perfect. And like with any viruses and any vaccinations, we have breakthrough cases. And the more people get vaccinated, just because of the mathematics, we're going to have more breakthrough cases. But I have to tell you, I'm very pro-vaccine. I actually suggest all my patients they get vaccinated, but I'm very, very anti-mandate. This is not a one size fits all. I was operating this morning. I saw a nurse in the operating room who was working in another hospital. Two days ago, she quit because they made her quit because she wouldn't get vaccinated. She got a religious exemption at the hospital. I was at this morning. And I said, why aren't you getting vaccinated? She says, my colleague, 39 years old, got vaccinated. She said she got the myocarditis from it. She's still out of work. She says, I've had COVID. I've got natural antibodies. She says, I'll take my chance with the natural antibodies. This is America. Let people take the risk if they want to take the risk. If you want to minimize your risk, get vaccinated.
Dr. Body, your colleague brings up an important point. Many of us are vaccinated, but people are still dying. And if the vaccine is not as effective as we have been told, is it proper for any private company or federal agency to mandate it?
Good evening. The vaccine is as effective as we've been told. I've been on this show now several times with Dr. Basuito, and he talks out of both sides of his mouth because on the one hand, he says, oh, the vaccine's effective. I recommend everybody to get it. Oh, but there might be this side effect. So you make the choice for yourself. When in reality, we know the data about myocarditis. The risk is infinitely small. We're talking maybe 16 cases out of every million people. It mostly affects young people, and the cases are mild. People recover within a few days. Very, very few people have been hospitalized because of myocarditis and the vaccine. And viruses in general, every respiratory virus is much more likely to cause myocarditis than the vaccine does. So it is reckless and irresponsible for any doctor to come on your show and say, oh, I recommend getting the vaccine, but everybody should be able to make the choice because there's these side effects. Well, you are perpetuating falsehoods when you come on the show and you say that people should actually worry about these infinitely small side effects. We would be so much better off if more than 40% of Michiganders still weren't fully vaccinated and everybody did their part to help get us out of this pandemic. Unvaccinated people are 11 times more likely to die from COVID than vaccinated people. That's just the cold, hard facts.
And so who are you to determine what person's risk should be and how they should determine to handle the risk? This is America. This ain't North Korea. This ain't Cuba. I got vaccinated and I want to minimize my risk. But I'm not going to. I want to see
America.
In
America,
I want you to look a mother in the eyes.
We've long since made the decision that we protect one another from things that can hurt us. You get in your car and you wear a seatbelt. Why? Because you have to. Click it or ticket.
But people who wear seatbelts also die, don't they?
That
people who wear
corporations
seatbelts die.
Don't pollute because we have regulated them. And yes, you're right. People who wear seatbelts don't also die, but they die at far lower rate because we've done the work of mandating them. And so I don't know about you. I know you're a surgeon, but I don't want to live in a world where more and more people fly through the windshield because we didn't mandate seatbelts. It's a thing we've all agreed upon. And I do think that as a surgeon, you should actually think about what's in the best interest of the people you serve. And I think in moving this misinformation, you're not doing that.
You know what? I think for all of us, though, we're all suffering from COVID fatigue right now. Think about it. 1 year ago this week, the state imposed a quasi-lockdown, temporarily canceling in-person classes for high schools, colleges, shutting down indoor dining, limiting large gatherings of people at sporting events and concerts. Charlie, should we be doing the same thing now, or are we at a different stage of this pandemic?
Well, I do think we're at a different stage. I think back when the governor was closing down restaurants and people went crazy because of that, but we didn't have a vaccine then. Now we have a vaccine. And from all these doctors on this panel, everyone agrees the vaccine works. But for some little time, listen, the odds are get the vaccine. I am curious, though, if the vaccine is so good, why shouldn't it be mandated? What is the harm of mandating a vaccine? And so I actually think that a mandated vaccine, listen, work mandates vaccine, schools mandate vaccines, for many of them, not all, but many of them. If you travel to other places, you pretty much have to have a mandated vaccine. You want to fly on a plane. So why wouldn't we just mandate the vaccine? Make it like a seatbelt. Why not? it's going to
You know,
save lives.
in Florida, they didn't mandate the vaccine. The governor's fighting against all mandates, and yet the case counts are falling. One possible reason they're falling is that the state of Florida allowed more people to die, and death is itself a self-limiting factor in the spread of the virus.
Also, Huel, we know that all respiratory viruses, influenza, RSV, and COVID, spread more readily in colder temperatures compared to warmer temperatures. So as we head into winter, 30, 40 degree weather, we expected cases to rise. We knew they were going to rise up here compared to Florida, where it's still 75 degrees and sunny. That's part of the process.
So what would you advise the governor to do now, if anything? What should we be doing then?
I'll be honest with you, right? The point that we started on is that these vaccines have been so effective that we are now in a position where the probability of mortality to COVID is so far lower than it had been, that we're in a situation now where actually the most important thing is mandate those vaccines. Because if we all want to live free of the kind of restrictions that we had seen, then we want to live in a society where more people are protected because they've done the thing that they needed to do and gotten that vaccine. The last point I'll say is this, just to Dr. Basuito's point. Look, your right to swing your fist ends where my face starts, right? And your right to choose not to get vaccinated ends where the breath that you're breathing out of your lungs is now going into my nostrils. And so the point is that, yeah, we have a responsibility to protect people from the unvaccinated and their higher probability of spreading this disease. It's something we have to do collectively. It's not just an individual rights issue. Every person who's unvaccinated increases the probability that more people get sick. And yes, more people will die. Vaccines have stopped that from happening. We need more people to take them.
First rule is do no harm. Well, there's a nurse at one of my hospitals who...
So stop spreading misinformation.
She lets her 18-year-old son get the
do
vaccine.
No harm.
He got myocarditis. He's a cardiac cripple.
Do no harm.
How can you say that do no harm? She would never go back and get her son vaccinated again. Now, in terms of, Farhan says that it's, tiny, tiny risk, and he's right. But people should be able to make that decision. And what's the role of natural antibodies? We see all these young nurses, 20s and 30s, they lived through 3 waves of COVID. Most of them have got the COVID. They've got the natural antibodies, and they're saying now, I trust my natural antibodies. Why should I take that vaccine? My body, my choice.
Because the data doesn't back that up. They can feel whatever they want to feel, doctor, but in medicine, we do things based off of evidence. And what the evidence shows is that natural immunity from being infected is not nearly as robust as getting the vaccine. And the most... Yes.
I agree with all that, but one last question. Are we at the point now where we're going to treat COVID like we treat the flu? Where we're going to have to keep getting boosters or additional shots every year to keep this virus in check?
Coronavirus is, the common cold is the coronavirus. We've never been able to get rid of the common cold. Why? Because it mutates. Every year it mutates. And I think that the COVID virus is going to be here forever, and it's going to keep mutating. We'll probably have to get boosters. And I think, the boosters will help control this. And the general trend for these viruses is they tend to get less virulent. They tend to burn out because the more virulent they are, they kill the host can't pass it. But yeah, I think it's going to be like a common cold. It's going to be like the common flu.
More reason to mandate the vaccine and say, to some extent, if you don't ban it, people will say, well, it must not be that good because you're not making us get it. I think there's a detriment there. Mandate the vaccine to see what happens. Let's take a look at those numbers when we have 80 or 85%, 90% of the population vaccinated. Then we'll take a look at those numbers.
Well, look, panel, difficult questions. We don't have all the answers, but I respect your opinions. Thank you so much. Stay with us. We might have time for final thoughts.
Michigan now is the highest state in the country for COVID. What should we be doing to get rid of COVID now?
Getting vaccinated.
Like, we were a little bit late to start a vaccination. I know New York and California were leaders for that.
Maybe even back to a little bit more of a shutdown.
Limit the capacity on certain social events.
Do you think the government should do more to maybe put a little pressure on people to try to be better protected from COVID?
I think so, only because that would help enforce with keeping the COVID rates down.
What the government should do is probably propose scenarios where we work with the health systems. I mean, we work for HAP and Henry Ford Health System, and there are mandates that are put in place that we're supposed to oblige by.
You guys are not really social distancing here. I don't see any masks.
We work closely together and we all have been vaccinated and have been tested recently.
Thanks for watching this edition of Let It Rip.